As a parent, you may have had that nagging feeling that something isn't quite right with your baby, despite your pediatrician telling you everything's okay. Maybe it's their sleep and they always need to be rocked and held to fall asleep. Maybe they're more colicky or uncomfortable, or they're more fussy than you would expect a newborn to be. Maybe it's digestive issues, constipation, reflux, something that your pediatrician is telling you, don't worry, they'll outgrow it, or it's normal baby behavior. However, what we find in our office is that your parental intuition, your gut instinct, is almost always right. So I believe that above anything else, you should trust your gut. And that's what I want to dive into in this video is what are some signs that there might be hidden stress in your child's nervous system, and how can you help them early on instead of feeling that like frustrated, wait it out, wait it out, wait it out, hoping they'll get better, because what if it just turns into something else, a different type of stress? And the reason your parental instinct is almost always right is that there is a study done by the Journal of the American Osteopathic Association that found that 99% of newborns had what's called somatic dysfunction. Basically, what that means is a fancy term for things are stuck, they're not moving well, and it's starting to impact their nervous system. The reason this is we'll go into more, but often has to do with simply a stressful labor and delivery. So I'm going to dive in here in a moment onto some of the different signs. But before I do, here's a copy of that study if you want to ever Google it. And looking at then, what are some signs that your child's nervous system is under stress? So I'm going to go through a few different slides here, but ultimately I want you to be looking out for things that, yes, might be common in babies, but it's not always something that's normal. It can be an underlying sign of neurological stress. And when your child's nervous system is under stress, it impacts things like sleep, digestion, ability to nurse, ability to move and hit milestones. Later on in life, one of the reasons we love helping babies now is because it allows them to have a stronger immune system, it allows them to do better with solids. It allows them to have better sensory processing and fewer sensory issues so they can handle the bathtub or feet on or grass on their feet or loud sounds easier. It allows them to focus and pay better attention in school. It allows them to have better emotional regulation, fewer tantrums, meltdowns, big explosive behaviors, all because when the nervous system is off, those things can develop later in life. So, the first category of different signs that your child might have some hidden stress in their nervous system, in their brain, their spinal cord, their neurology, are sleep challenges. Maybe it's tough to fall asleep or stay asleep, restless sleep. They always have to be held, they always have to be in motion. They need a super careful bedtime routine where you have to tiptoe out of the room just right in order to keep them asleep. Next category here is feeding difficulties. So maybe they are not latching well. They can't open their mouth very wide. If they do get food in, they spit up a lot. Maybe they take a lot of air in when they nurse. Another sign is maybe they nurse really easy on one side, but not so well on the other side. If they become easily distracted, or we had a newborn that just started that mom and dad said, yeah, he just nurses forever. After his first adjustment, actually, they said his feeding times came way shorter because he started to become more efficient and actually getting the food into his belly the way he was supposed to. Once food is in, how is his or her nervous system able to digest it? Are they constipated? Do they have a lot of gas? Do they have signs of colic where they're fussy for several hours a day, several times a week? Maybe, as I mentioned before, reflux, or maybe you see them kind of like grunt or moan or kick when they're trying to poop. On the physical side of things, when the nervous system is under stress, it can start to prevent proper movement. That's this somatic dysfunction study that I mentioned previously. Because when the nervous system is under stress, you may have experienced this yourself, things tighten up, the shoulders go up towards your ears, and your body doesn't move as freely. So maybe your baby prefers to turn their head to one side. Every time you put them in their car seat or every time you check on them when they're sleeping, they're always looked one direction. They maybe, if their head isn't moving well, one side of their head starts to become flat. Or we see some babies where they kick one leg all the time, or they're always moving one arm, but not so much the other side. On the sensory side of things, for early in life. Maybe they have a heightened startle reflex. What that might look like is if something startles them, they expand, they take a breath, they reach out, and they get stuck there. This is something that should happen, but then baby should curl back in. And over time, they should start to have fewer and fewer of these startle reflexes. Maybe if the environment's extra stimulating, they're just extra irritable, more than you would expect. Or if they do get revved up and stressed, they have a really tough time calming down, no matter how much you rock them, or soothe them, or swaddle them, or shush them. They just stay revved up. So, if those things are going on in your baby, those are signs that their nervous system isn't in this grounded, calm, peaceful state that we want it to be. Because when it is in a calm, grounded state, like I said, it's setting them up for neurological development from not only eat, sleeping, and pooping early on, but then being able to roll, to sit, to crawl, to walk, to go through those muscle motor milestones, to integrating their sensory experiences from a vacuum cleaner to sunshine going outside, to brushing their teeth, to introducing solids and not being picky about what texture they take on, to playing in the sand and getting their hands and feet dirty. All those things start to layer through the nervous system. So when they are now introduced to foods, or their immune system has to practice fighting off bugs, that is part of neurological development. And then speech and handling emotions and behaviors, meltdowns, all those things is actually at the top of the pyramid for neurological development, but it all starts with this foundation. So that's why we get passionate about helping kiddos lay the foundation for all those things to go as smoothly as possible. So if you ever wonder about your child, there's 2 tests that we do on infants in our office. They're very safe, very gentle. They're helping us measure for nervous system dysregulation and stress. One is this heart rate variability scan, which helps us see overall, is their nervous system dealing with the environment, or is stress starting to weigh them down? If this white dot is coming out of the green, it means stress is wearing them down. And then the next one is measuring all the nerves that go along the spinal cord and go out to the different body parts. If we see white bars, we know those nerves are doing well. If, because again of this study of somatic dysfunction, that can stress these parts of the nerves, and most common is actually the neck. The reason this is because the neck is the most vulnerable during birth. So a lot of times parents wonder, like, how does my child, my newborn baby, why are they under stress? They're not paying bills. They're not going to prom. They're not studying for ACTs. Where's this stress coming from? And a couple of things early on. One, it can be a stressful pregnancy. There's a lot of research that shows the more stressed mom is during pregnancy, the more a baby's nervous system starts to wire for stress early on. And then the biggest piece that we see often is the labor and delivery process. Bringing a baby into the world, even in a smooth labor and delivery, is a lot of stress on baby's head and neck as they're being pushed out. And then if you add interventions, things like induction, C-section, vacuum, forceps, maybe labor was stalled, maybe they had to pull a shoulder or pull the head through, all those things add even more stress to this part of baby's delicate developing nervous system. And that's why, as in this scan example here, we see the neck in the red. That's significant stress on that part of the nervous system. That's, again, the most common area that we see. So if your baby is experiencing any of the things that I listed previously, please know that you can reach out for help. Please know that your provider, your more traditional pediatrician, might be overlooking things or saying, let's just wait for down the road to see if they need something down the road, or maybe they've recommended a medication, say for their reflux, and you're like, it just doesn't feel right. I feel like they should be able to handle things on their own right now, being so new into the world, and you want to provide them with that best opportunity. If that's the case, please reach out. I'd love to see what these scans look like on your newborn, and if things are looking great, awesome. And if there is some stress underlying things under the surface, that's something that we love to help with very safe, very gentle neurological adjustments. So I'll show you one picture here quick. This is baby Liza getting adjusted. It actually is something that is about as much as checking the ripeness of a tomato or an avocado. So very gentle, very delicate. She had been dealing with a lot of reflux and also was very stiff. Once we started adjusting her within a few weeks, not only was her digestion improving a lot, but mom noticed she was way more pliable, way more free to move, and way more comfortable in her body. So please reach out if you have any questions, if you'd like to see what your child's scans look like, and we're here for you.